Hi, my name is Josh. I'm a pharmacist with pharmacisttips.com, here to tell you a little bit about Trazodone 50 milligrams. We're going to talk about some of the uses, the common uses, the dosage, and some of the potential side effects that can be experienced with Trazodone. First off, what is Trazodone? It's a antidepressant. It's commonly used, however, for sleep and anxiety. We see it used a lot for that. I would say this is the most common use. In the US, it's sold under the brand name Desiril, and it has effect on serotonin. Many of the medications used for depression have an effect on serotonin. This is included in that group. It prevents the reuptake. So common dosages of trazodone for the sleep or for anxiety, we see usually 25 to 50 milligrams at bedtime. For sleep, we usually consider the max dose to be around 200 milligrams per day. When used for depression, it's used 50 milligrams 3 times a day, starting with a max dose of somewhere in the neighborhood of 600 milligrams. Again, dose always varies on the person. Your provider will help to determine the appropriate dose for you. One thing is, if there's some liver issues, usually the doses need to be lower. How long does it take for trazodone to work? How long before you notice the effect? If you're using it for sleep, it's usually it peaks in 1 to 3 hours. A lot of people report taking it about a half hour to an hour before their expected bedtime, taking it with a snack, and then it's really kicking in as they're ready to go to sleep. Of course, you'll want to follow your doctor's directions when you take that. The antidepressant effect can take up to 3 weeks to occur, and that's common. Most antidepressants, it takes that long for the peak effect to be noticed. Why do I have to take trazodone with food? We get that a lot. On the label, it will usually say take with food. Food actually improves the absorption. It also may decrease some of the side effects that can occur, such as the drop in blood pressure. It also may extend the peak or extend how long the medicine is in your blood, so kind of make it last longer so you get that good night's sleep with the trazodone. Common side effects. So these side effects um, can occur in probably greater than 10% of people. But if you notice, these side effects are why we use this medication to sleep. That's why it is commonly used to help people rest. And like I said, these are usually mild, these common side effects: dizziness, drowsiness, headache, nausea, and dry mouth. So, like these are going to help people fall asleep. And we don't see a lot of the headache, nausea, dry mouth, but they can occur. But like I said, most people welcome that drowsiness because they're using the trazodone to help them sleep. Some less common, we're talking like, 1 in about 10 people can have some of these side effects: diarrhea, nervousness or a tremor, blurred vision, constipation can occur. Some fluid retention or swelling. So if you notice swelling in the legs or extremities or fingers, you'd want to speak to the doctor, see if we need to change something, see if something else is going on there. Vomiting can occur, fatigue. Again, we use it for sleep a lot, so for most people, probably not an issue. Headache can occur, drop in blood pressure. So we need to be cautious about that low blood pressure, especially if you get up to use the restroom in the middle of the night. You just want to keep in mind you could be a little bit dizzy when you get up, so so you don't fall or anything like that. Other side effects can occur. So rare, serious, we're talking like less than 1%, but these things do happen, so you need to be aware of them in case you notice anything, so you can contact your provider right away. It can increase risk of bleeding. It can have effect on heart rhythm, so we need to keep that in mind if there's existing heart problems. As with any um, medicine that has effect on mood, there's a very, very small chance of suicidal thoughts. If you noticed a change in thinking, you need to contact your provider right away, seek medical attention. Serotonin syndrome, we'll explain that just a little bit more on the next slide. Priapism occurs in males. It's an erection that lasts more than 4 hours. You need to seek medical attention if that occurs, as well as other side effects can occur. So what is serotonin syndrome? That's something we need to watch out for. It can occur with the trazodone, especially if you're using other antidepressant medications with it. This kind of often comes on quickly. You can have some dilated pupils, extreme agitation, mental confusion. Your muscles can be tight. And when it's bad, you can have seizures, rapid heartbeat changes, sweating, fever. This is a serious medical condition, and you need to seek medical attention right away. Again, it's extremely rare, but anything that has effects on serotonin, we should just be aware of the potential for this. And if it does occur, we seek medical attention. What about herbal products with trazodone? We need to watch out for herbal products that kind of have the same effect in the body because they could compound the effect of each other and give you more of that effect than desired. So the ones we want to watch out for and really you probably shouldn't use unless you've talked about it with your doctor would be like St. John's wort, SAM-E, kava kava, and valerian root because they all, can affect that serotonin. They all can have a sedation effect. And we just don't want to increase the side effects. What about trazodone and alcohol? It's really best to avoid that. Um, you can have an increase in sedation because alcohol and trazodone can um, sedate the central nervous system a little. And alcohol decreases the quality of sleep, decreases the quantity of REM sleep. And it just doesn't give you restful sleep. If you're having some sleep issues, you really owe it to yourself to back off the alcohol consumption. You're not doing yourself any favors by consuming alcohol. It may help you fall asleep, but you're not going to get good sleep with that. What about drug interactions? Some that we need to watch out for. Amiodarone, that is for heart rhythm. We kind of touched on the issue that we have to watch out for the heart rhythm problems because it can affect the heart rhythm. Digoxin is a medication used to regulate the heart, often for a condition called AFib, but other things as your doctor determines. It can increase the levels of digoxin. This doesn't rule out using the two medications together. Your provider may do that, and they can be used together safely if they're watching for signs or symptoms of too much digoxin in your system. Phenytoin, often used for seizures. The trazodone can also increase levels of phenytoin. Again, can be used together, just need to proceed with caution. Fluoxetine, paroxetine, venlafaxine also increase that risk that we touched on, that serotonin syndrome. However, you will see these used together quite frequently and without any issue. Many people who have some depression issues also have some sleep issues, and it requires more than one medication to help them with that. Just awareness is what we need. Warfarin, we talked about that blood thinning effect, so that's another thing we need to watch out for with that. And others can occur. Your pharmacist will screen for those while they're filling your medications and discuss any potential ones with you. What about trazodone withdrawal? This is going to be highly dependent on the dose that you take and how long you've been on the medication. If you're on a higher dose, you're gonna want to taper. That is something that your doctor and you can determine the best way to do. Typically, a taper, though, we see the dose reduced by about half every week or so. So if you've been on 100 milligrams, you cut down to 50 milligrams every day at bedtime. You're feeling good with that, you cut down to 25, and then you can go 25 every other day. And then you just kind of taper as you tolerate. Everybody is different. Some people report really uncomfortable feelings when they try to go cold turkey off trazodone. So just keep in contact with your provider or your pharmacist, kind of talk about issues and if you're having some side effects as you're trying to go off trazodone. I appreciate you watching this video. I hope you found this information useful. Remember, always speak with your healthcare provider if you're having some problems, if you think you're having some side effects, the medication is not working like you think it should. Please subscribe to my channel if you find this information useful. And if you have any questions, go ahead and ask it below. I'll try and answer it. Thank you.